I'm Undersheriff Jesse Anderson. I serve under the Sheriff Patty Cole-Tyndall, and I'm here to talk about what we're dealing with out in our communities in King County today. Fentanyl, huge problem. Guns, huge problem, right? We're having violent crime that's impacting our communities, and what we want to talk about is what's behind this, right? What is driving some of this violence? And as you can see with some of these photos here, we certainly have an epidemic. You'll see primarily pictures here of fentanyl pills, some of the powder that's associated with it, the cash, right? Large volumes of cash that are coming in as a result of the sales of the fentanyl, and of course guns, right? We're talking semi-auto type rifles there. We're just dealing with, a significant epidemic, public health crisis within our community, as well as the impacts of the violent crime that's associated with it, the organized crime, as well as property crime. It's all tied together, and we're all experiencing that in our communities, and we need to continue to make these efforts to try to get this under control.
I'm interested in the volumes of narcotics that have been taken this year, and how that's changed from the past.
So, as years gone on, I've been around for over 30 years now, and I've seen the different types of narcotics that's being distributed out there. What is the most popular, right? What's in demand? And now it's fentanyl. So what we're seeing is just a continual increase in fentanyl pills themselves. To give you an example, last year in 2022, we see these units that we're talking about here. So there's 4 plainclothes teams that are out there working specifically on this type of crime. And what they seized this last year in pills, fentanyl pills, equates to about 8 5-gallon buckets of pills, just from that.
Over 750,000 pills.
Yeah, over 755,000 pills.
Yeah. The tragic thing here is that fentanyl is much more potent than heroin, 50 times as potent as heroin, and cheap. And we've seen this terrible upsurge in overdose deaths in our community because of it. The teams that you're talking about are called special emphasis teams, right?
Correct.
They consist of detectives along with the sergeant, and they have led the way in apprehending all of this, including the guns. But we have a much broader approach. So last year we went to Precinct 4 and announced a comprehensive public safety initiative, and it includes this work, this more traditional work, but being done with, I would say, even more serious stakes here to get these toxic drugs off the street, but also investing in mental health professionals to be involved with our negotiating teams so that we can avoid a crisis in that moment and try to apprehend someone. More work upstream to prevent young people from coming into gangs and drug dealing, and also to try to get to young people who are becoming involved as users of drugs and get them into counseling. And overall, a more comprehensive approach to trying to prevent harm. This is a challenge that is not going to go away immediately, and we need the help of the federal and state governments. But this work was the King County Sheriff's Office. And as you're probably aware, it was just last year that I took over responsibility for the Sheriff's Office and appointed a new sheriff. And I want to commend Sheriff Cole-Tyndall, as well as you, for really excellent work, working with community to begin to reduce a danger that is taking lives at an alarming rate in King County. And I just wondered, do you have any additional insights into how communities can help us be able to remove this danger from the streets? Communication,
letting us know what's going on. The way we're successful in taking care of the crime problems in our communities is that engagement with community members. We know what's going on because of the help by our neighborhoods, the community groups and different organizations within the communities, letting us know where they're seeing some of these problems so we can start focusing our resources in those areas and to go after the dealers, right? We certainly need resources to help those who have an addiction problem, but it's these kind of folks here that are creating that problem. They are the menace to our communities out there, and we need to continue those efforts to stop that, and we need to work together with community to make that happen to be successful.
These kind of problems are not limited to the borders of King County. This is a crisis nationwide. It's my understanding that in North America, a lot of the fentanyl manufacturing is happening in Mexico, although globally a lot of it happens in China. And the problem here is that it's just what you said. Fentanyl is so potent and being manufactured in an unregulated way and then cut into other drugs potentially in an unregulated way, the users have no idea what they're getting. And so that is why we're seeing so many overdoses out there. This is part of an evolution, over years of drugs becoming more dangerous, more compact, easier to smuggle, easier to distribute. And this particular challenge is one that we're going to have to take on at the national level as well as state and local. We can't keep simply chasing after drug dealers and expecting that to solve the problem. The problems involve national and international cartels.
It's a multifaceted approach, right? We need to educate. We need to educate our youth upstream on, the dangers of this drug. That this is not marijuana, right? This is not something that you can just go out and take expecting, a high and no negative side effects. This is killing, and we never know which one of those pills, for example, that you're seeing here, may be a lethal dose, and it's over with. Right, and so we need to get out there and educate, continue to do the enforcement, prosecute, looking at things from a public health standpoint, which is getting the treatment people need, compelling them into treatment, not just saying, here we have this option for you, do you want to take it, which is the way it's set up now. We actually have to have some mechanism in place that we can actually get people into treatment so they can get helped.
Crisis Cares Center's proposal is something we worked up with the business community, the labor community, and particularly those who are working in the mental health and addiction fields to meet an unmet need. There's not one place in King County you can go right now if you're in crisis, walk in yourself, be brought by your family, be brought by a human service agency. None. This would create 5 centers in regions around the county, as well as one specifically for youth, where you could go in a moment of crisis and get the help you need immediately, and then you can move to a residential treatment bed. It would also rebuild the number of residential treatment beds. We've lost about 1/3 of them over the last 5 years. And those are critical to helping people get the help they need, recover, and get on with their lives.